Well, thank you for having me. I am Anna Fadich, and I am a woman running a men's health organization. Sometimes that's what you need, right? So Men's Health Network is a nonprofit organization based here in DC, but we have partners and affiliates across all the countries, all the states, and in 30 different countries. So we aim to educate men and their families about the importance of men's health and getting men to take more initiative in their health. So we're reaching them where they live, work, play, and pray. And we heard a lot about social media and guys and young millennial people being on their phones. Well, that's especially important for men because men sometimes we find are hard to approach, or they are kind of reluctant to come talk to you about health issues because they have that macho feeling. They don't want to show that they're vulnerable. So we're trying to get them where they're comfortable. So a lot of social media activity, a lot of blogs, different educational programs. We have our workplace initiative where we work with different corporate employer sites to get the messaging for men's health specifically at the workplace, and then also working with different sports teams and faith-based communities. So as we're doing this, we're looking at these guys from young age to about 35, the millennial population. The younger ones under the age of 25, they're typically still in school or just starting their professional career. They're not thinking about healthcare. They're not thinking about, other than I work out, I'm healthy, I'm invincible. So that's what we're trying to change, that idea of I am invincible, because they think cancer is an old man's disease. They don't think that that's going to affect them, but it does a lot of times, especially for that age group, testicular cancer. So we reach them with these messages at the workplaces because, as someone had said earlier, they're a captive audience. They're not taking the time off to go to these different activities. So if it's incorporated into a work health fair, then they're participating in it. With sports organizations or sporting events that they're doing, whether they're local or they're professional sports, guys are comfortable there, so we put our messaging into those arenas as well. These guys are not always, typically they're not the ones that are parents at this age, so when we're talking about them, we're sometimes talking to their parents and their older loved ones about men's health and trying to get their kids to go to the doctor. So a lot of these young adults are under 26, so they're on their parents' insurance still. When we're looking at competition at any age group, they're very competitive with their friends, their colleagues, and so anything you can offer working with a sports organization or a fraternal organization to say who can do the most push-ups or who can lose the most weight, who can lower their cholesterol, all things that are going to get guys engaged. So we want to motivate these younger guys to be more involved in their own health and getting their colleagues to do it. So then we're talking about older guys from 25 to 35, and some of these may be parents at this age. They're more involved in their careers. So in addition to reaching them in their workplace, we're looking at these men as role models. So we're trying to address them as role models, saying for your children, for your nieces and nephews, do the right thing, enroll in health insurance, be active, get your screenings done, be more involved in your own health. So again, looking at the competition and trying to get them to be, man up, as a lot of them say. But this can't be accomplished unless they're actually getting the services provided. So for Men's Health Network across the ages, we want to try to incorporate messages from working with different PR firms and media to address men's health and get those issues as a solid campaign across the board, getting men to see the same messages on social media, Twitter ads, Facebook ads, in movies. There have been a lot of change in media and having guys portrayed in a different way. So now instead of the Homer Simpson type dad, you're seeing more of a involved and active parent, sometimes single parents, fathers taking that role. So we encourage a lot of the women in their lives to help with getting the messages across and getting them to go to the doctor, but also reaching these young men under the age of 35 and encouraging them to be more active and work on getting insurance and using the services. So what we found is, as I had said, men are less likely to come to you and talk about personal health issues because it makes them look less masculine. So Twitter is definitely a place that these guys are going. We host a lot of Twitter chats. We work with different partners, different nonprofits, government agencies to host these chats that are going to address issues that are affecting men. So they're coming on there. There's that sense of anonymity. They could be whoever they want to be. They don't, you don't have to put your picture on there. You don't have to give a lot of detail, but you can ask the question and get a response back. Forums as well, they used to have Yahoo forums, Google forums, Google Hangouts, any kind of things like that, where someone can go and post a question anonymously and then get a response back. We have 2 forums that we work with, Health Unlocked and Inspire, in which we have men's health topics on there. So these guys and ladies come in and ask questions specifically about their own health or their partner's health. So we try to regulate that as much as we can and answer any questions that people have, because we understand that they're not always going to the doctor direct and asking, because you go to the doctor, I mean, how many people, okay, this is what I'm going to talk to the doctor about, and then you get in there and everything is gone. The doctor is just telling you, this, and this. Like, any questions? No. Okay, see you next time. So you forget about that. So that's kind of where these guys can come and ask their questions. Facebook as well, but we see a lot more engagement on Twitter. Men's Health Network has partnered with Coverage to Care and have done different Twitter chats on how to get covered, and then another chat on, okay, now you're covered, now what do you do? We put out fact sheets, different messaging on our social media, and refer people to those different sites, because it is important not only to get them covered, but hey, now you're covered, so what do you do? We work with some navigating organizations, so we refer them to patient navigators. We try to help them out as much as we can, so really trying to bridge that gap and get them to understand, because navigating the website itself could be a little difficult. Live, work, play, and pray, right? So we try to be in as many places as we can. Obviously, the messaging changes, because what the kind of programming and messaging you do at a sports event is going to be completely different than the kind that you do at a faith-based institution, especially if it's right before or after a service. We also rely a lot on our community partners. As I said, we are in all 50 states. A couple of the groups that we work with, Phoebe Putney out of Georgia and Integris Health Systems in Oklahoma, they do a lot of activities. In fact, they were just doing this weekend and in the coming weekend, they're doing events for men's health and prostate cancer. So they know their community, they know what the population is. We send them materials, we work with them to develop the programming, and then they disseminate it as they see fit. We attend the events, we'll fly out some of our folks from DC to attend it. We have colleagues who go to different conferences. We just worked with the Osteopathic Association, we were at their conference, but we attend the Public Health Association conference. So really trying to spread where we are as much as we can, because you never know who you're impacting. Some people will say, what are you guys doing at this, at this conference? It has nothing to do with men's health. But there are men who attend, there are women who, have men in their lives. There are programs that we could do. Men's health and women's health is, so closely knit together, and it's more than just sexual health, which is a lot of what people think, like, oh, sexual reproductive health. No, but I mean, health conditions affect men and women, equally, just in different ways, because we're all made up of different, our systems are just different. So we try to be in as many places as we can. So I'm going to say, it isn't just that the one time here, you should sign up for health insurance and then you don't see them again. It is the continuation, but also the reaching these guys, not only about their messaging, but to talk to them about their kids and their older loved ones. So a guy who's 25, 30 years old may think right now I'm healthy and nothing's wrong, I'm not going to get health insurance. But then educating and saying, no, going the different paths, saying, okay, well, your parents, think about your parents, help them through it. So then as he's helping them through it, he's thinking about himself. So then he may reconsider getting it. Or, okay, your child needs to go to the doctor and trying to teach him that. So really, instead of just speaking to the guy himself or the group of guys, getting them to understand that it's more of a conversation for the larger population, getting their friends to sign up as well. So changing the conversation